placental swabs and maternal sepsis investigation, a single institution retrospective review. This project was completed in collaboration with my colleagues in UMHL, Department of Microbiology, UHL, School of Medicine and Centre for Interventions in Infection, Inflammation and Immunity in University of Limerick. It is well known that sepsis is an important cause of maternal morbidity and mortality. According to the most recent IMBRIS report, sepsis is an important cause of maternal mortality in Ireland, representing 0.8 per 100,000 direct deaths in pregnancy. International and national guidelines recommend completing septic screens to determine the source of infection. Determining the source of sepsis can be influenced by a number of factors. There are physiological changes associated with pregnancy, including increased heart rate, respiratory rate, and white cell count, potentially masking sepsis. Intrauterine infections tend to be polymicrobial. Organism identification occurs in approximately 50% of cases, and blood cultures may be culture negative in 28 to 49% of septic patients. This case report was previously published by my colleagues in UMHL. The case report discusses the clinical merits of placental swab cultures. This case describes the management of a preterm infant who was delivered at 23 weeks and 6 days. Subsequent placental swab cultures identified Echinella, guiding further antibiotic therapy. There are a number of studies available in the literature discussing the clinical utility of placental swab cultures. General consensus is that placental swab cultures completed in the context of maternal infection or PPROM may provide useful information to guide antibiotic therapy. The objective of this study was to evaluate the clinical value of microbiology samples, particularly placental swabs completed as part of maternal septic screens. In our institute, septic screens are completed in accordance with national guidelines, namely IMU's triggers and 2 or more SIRS criteria as listed. This was a retrospective study conducted over a 5.5-year study period, evaluating data collected from July 2016 to December 2021. Data collected included high vaginal swabs, placental swabs, blood cultures, throat swabs, and urine samples. Ethical approval was granted from the Research Ethics Committee in University Hospital Limerick. Overall, during the study period, 430 patients had septic screens, including placental swabs collected. HYPE data was available for 410 of these patients. From the patients who underwent septic screens and placental swab culture, 402 patients had singleton infants, and there was 8 sets of twins. Most of these infants were delivered via cesarean section. Also, most of these infants were delivered at 37 weeks or beyond, and most presented premature rupture of membranes between 1 to 7 days. This bar chart represents microbiological specimen results and is further subdivided into sterile, likely pathogens, and likely commensals. 403 blood cultures were sterile, followed by 224 placental swab cultures and 201 urine samples. 165 placental swab cultures detected likely pathogens, followed by 142 high vaginal swab cultures and 30 throat swab cultures. 305 swab cultures identified commensals, followed by 288 high vaginal swab cultures. This table further subdivides the type of pathogens that were found. 51 placental swab cultures identified Enterobacteriaceae, 56 high vaginal swab cultures and 34 placental swab cultures identified group B strep. 35 placental swab cultures identified Streptococci, and 77 high vaginal swab cultures and 62 placental swab cultures identified anaerobes. This table describes the significant isolates from blood cultures and their detection in other specimen. In the first patient, Streptococcus viridans was detected in blood cultures and placental swab cultures. 2 patients had group B strep detected in blood cultures, high vaginal swab cultures, and placental swab cultures. E. coli was detected in high vaginal swab cultures, blood cultures, and placental swab cultures for 1 patient. Of course, there are a number of strengths and limitations to this study. This was a comprehensive data set collected over a 5.5-year study period. This was a single-centre study with uniform data collection and a sepsis protocol. Placental swabs are non-invasive, easy to collect and process. Limitations include the retrospective design, lack of patient electronic records, limited access to clinical data, including patient risk factors, clinical presentation, vital signs, timing of antibiotic administration, and placental histology. These findings can only be limited to patients who meet the septic screen criteria. So this brings about the question, how does this presentation fit in with the theme of today's conference, capturing the full picture of fetal and neonatal outcomes, the iceberg phenomenon, the continuum of care? It could be said the tip of the iceberg represents blood culture positive patients, while the bottom of the iceberg represents blood culture negative patients. Clinical implications. From the 5 microbiological samples, placental swab cultures yielded the highest number of likely pathogens. Blood cultures are mainly sterile, with 9 samples detecting potential pathogens. Positive placental cultures, completed as part of septic screens, may guide appropriate antibiotic therapy to improve maternal outcomes. Future studies should correlate and evaluate placental swab cultures containing likely pathogens with placental histology and clinical parameters. In conclusion, placental swab cultures completed as part of maternal septic screens were useful for detecting potential pathogens. Placental swabs are non-invasive, accessible, and easy to process. Given intrauterine infections tend to be polymicrobial, and our study found 95% of blood cultures are sterile, placental swab cultures may be useful to identify potential intrauterine infection to guide further antibiotic therapy. I would like to thank Mr. James Fell and Dr. Bree Minahan for their assistance and support in making this presentation. Thank you very much for listening.